Hello? Are you William?
Yes, I am.
Hello, I'm Dr. Dimitropoulos. This is my assistant, Dr. Skelton. So what brought you today and what might consider you?
So lately my wife has been saying that I've been acting a little strangely, more aggressive towards her than normal. Along with this, I've been feeling lightheaded and a lot more headaches and I guess kind of dizzy.
Oh yeah?
Yeah.
Have you had any interactions with animals lately?
Only my parrot.
Not you, doctor.
No, I don't have any pets, but I did meet a really friendly dog in the park the other day.
Was he acting strange then?
I guess a little bit, yeah.
So did you notice any symptoms of like a tone of bark or inability to swallow or constant change in behaviour?
I guess, yeah, all of them. And also had excessive saliva and like foam around its mouth.
Oh,
like,
really?
it-
Oh, okay.
Okay, did the dog scratch you or bite you?
No, it was really, really friendly. It kind of just licked me though.
Unfortunately, Dr. Scales and I strongly believe that you have rabies. When the dog was licking you, we believe the rabies virus was passed on through the dog's saliva. However, this would only be possible if it got into an open wound. The other way that you could have got this virus is if the dog bit you. Rabies is a viral disease that causes inflammation to the brain in humans and other animals. It is spread when an infected animal scratches or bites another animal or human. This causes the saliva to get into the mucous membranes.
Go to the hospital where they will most likely do blood tests and take samples of your saliva. At the hospital, you will also receive some fast-acting shots to prevent the virus from infecting more of your body, which you will receive 4 more shots over the next 14 days.
Thank you, doctors.
Yes, sir. So Dr. Dimitropoulos and Dr. Skelton tell me that you might have rabies. Nothing is certain yet. I'm going to run you through a few tests. May you please hop on the bed?
Yep.
Open your mouth, please. Oh, I can see some foam forming around in the mouth. That is unnatural. You can close your mouth now. The foaming in your mouth tells me there is some extra saliva producing in your gland, creating the foaming at the mouth. Dr. Dimitropoulos told me that you've been licked by a dog that ate excessive saliva. Is that true?
Yeah, it's true.
So, okay, I'm now going to ask you a few questions, and I would like you to answer them at the best of your ability. Do you feel any different than you did before the dog situation?
I always find myself in random deep thoughts and confusion. I've been getting more like headaches and dizziness and also more muscle pains.
Yeah, okay. I'm quickly going to run a test. Could you please look at the light?
Okay.
Oh, that is worse than a normal human. I've noticed you've had some excessive movements, and I've noticed spasms of the muscles in the throat and the larynx. This occurs because of rabies affects the area of the brain that controls swallowing, speaking, and breathing. May I please feel your tonsils?
Okay.
Yeah, they feel inflamed. Let me just take a quick note on that one. Okay, well, I'm going to take a sample of your blood, and I can give it to someone who's going to do a direct fluorescent antibody test. This test will detect presence of a particular antigen. This will be seen through a fluorescent microscope.
Alright.
Hello, Dr. Skelton.
Contact.
This is Will's blood sample. Can you take it to a fluorescent microscope to examine, please?
Yes, sir.
Sorry, Will. Unfortunately, me and Dr. Goldsworthy have come to the conclusion that you have rabies. I'm sorry to hear. The test we did came back with fluorescent green markings, indicating that you have the virus. I'm sure the disease has come from the dog, by the foam going through a scratch onto the body through another way. It only contagious if your saliva gets into someone else's body. This disease will affect your nerves and brain, and you'll feel more out of ordinary in the next few days. However, you have been told about this earlier, so there's a strong chance we could treat you if you could get through it.
Yeah, okay.
For now, I'll give you a fast-acting shot, which is a rabies-immune globulin, to prevent the virus from infecting you anymore. You should take at least 4 shots over the next 14 days, and you'll start to feel better. I'll do the first one now for you.
Okay, thank you.
How does that feel?
Alright.
Okay.
Thank you, doctor.
All good, sir. Just remember to have those 14 shots.